Hello, welcome to today's Insta Live, and today we're going to talk about a very important topic. We're going to talk about recurrent miscarriages, possible causes of recurrent miscarriages, and possible tests that we can do. And we're going to be joined by Alpesh Doshi from IVF London a few times. And Alpesh is the embryologist and director of IVF London Clinic in London. Welcome again, Alpesh. How are
Hi,
you?
how are you?
I'm okay. How are you in the UK? I'm in Portugal at the moment.
Yes, I saw. That's great. You having a good time?
Yes, it's good to be doing some work with some sunshine for a change.
Yes, absolutely. Things are
And
wet in London. It's been raining, so can't expect better weather.
And Alpesh, we are now in a week where we're talking about miscarriage quite a lot. It has been Baby Loss Awareness Week. There was the Wave of Light campaign, and it's great that there are so many activities online where we are raising awareness of pregnancy loss, because it is a reality that a lot of times we don't talk about, and women don't talk about, society doesn't talk about in general. Do you find that your patients, when they come to you, they have been through miscarriages quite a lot? Is that a common experience?
So, as part of assisted conception or any kind of conception, miscarriage is part and parcel and a reality of life. And of course, miscarriages affect some patients a bit more than the others. And there's many reasons for miscarriages. Typically, from a statistics perspective, we expect 20% of the pregnancies to miscarry. And this is almost, 1 in 5, or sometimes even 25% of the pregnancies to miscarry. The impact can be higher in some patient populations and lower in the others. But of course, as part of an IVF setting, dealing with repeated miscarriages is also something we are highly involved with in terms of treatment and therapy.
And recurrent, I have been reading that it happens 1 in 100. So 1 in 100 women go on to experience more than 2 miscarriages during following in their reproductive years. And that's quite a lot, because it takes a lot of courage to go back and try again after you've had 2 pregnancy losses.
You're right, Andrea. Usually with miscarriages, it leaves a more longer lasting emotional imprint rather than the body being able to try and conceive again. The body recovers pretty fast, but the emotional turbulence it leaves a couple with is probably the scare of not wanting to try for a while. And yes, recurrent miscarriage is something which is rare, but not rare enough because, again, we see this quite routinely in the IVF sector. But the good thing is that with modern day medicine and therapies, there are various treatment options that we can perform on couples who have faced repeated miscarriages. Generally, with one miscarriage, it doesn't get investigated, but when a couple or when a woman has more than 2 miscarriages, we would start investigating the reason for them.
And if we could go nail it down a bit further, then I can imagine that those tests are potentially tests that look at maybe maternal factors, paternal factors, or the uterus, or maybe the embryo even. Would
Sure.
that be accurate to say?
Absolutely, and this is going to be a long answer from my side, but typically miscarriages can be broken into 3 different categories. One of them is anatomical, which means a structural abnormality with the uterus. So when we talk about anatomical causes, they can be things like fibroids, polyps, something called a bicornuate uterus, whereby there's an an abnormality in the shape of the uterus. Or some women can have something called Asherman's syndrome, which leaves scar tissue within the uterus itself. So when you have these kind of gross anatomical abnormalities in the uterus, that can also be a cause of miscarriage. So that is what we call the anatomical reasons. Then we have hormonal reasons for miscarriages, such as an underactive or overactive thyroid in women that can affect the lining of the uterus itself. And hence, if the lining is not of decent thickness, then the pregnancy can miscarry. The same thing with high prolactin, for example, in women, that if they have a very high prolactin levels, it can affect ovulation, and of course, it can affect even the lining of the uterus. So there's some hormonal reasons as well. And then we have embryological reasons, and typically 90% of the miscarriages, Andrea, are due to embryonic reasons. And when I say embryonic, what I'm referring to is genetic abnormalities in the embryos. One of the most common culprits in IVF, when a pregnancy does not happen, or if a pregnancy happens but it miscarries, the main reason for this is embryological aneuploidies, meaning genetic abnormalities in the embryo. Now, this is not to say that IVF per se is adding a higher risk of aneuploidies or genetic abnormalities. It has got to be understood that we as humans have more things wrong with our eggs and sperm than right. So typically a lot of the eggs that we produce or what the ovary produce is not capable of forming a pregnancy or a live birth. And hence, generally it would result in a failure to implant, or if it implants, then it can result in an early miscarriage. Sometimes women don't even know that they have miscarried. They just have a very, very heavy period. But in reality, the embryo could have implanted and could have had a very early loss. So that is embryological reasons. And of course, we'll talk about the treatments as well for all these different causes. And lastly, we could have what we call immunological factors for miscarriages. Things like natural killer cells. In some women, they have a very high level of natural killer cells in the uterine environment, or even in their blood circulation. And again, this is a very new area that is being looked at or being investigated with a lot more research. The jury is really out there to say that with immunological factors, such as high natural killer cells in women, what are the therapies that work? And there's a lot of research going on about that. So those are just some of the factors that can cause miscarriages.
And you reminded me another embryologist who told me once that humans are really bad at reproducing. When you said that 90% of the causes are within the embryo that originates from eggs or sperm that is not very good, or it has something wrong with their chromosomes. So that goes maybe against everything that we were taught at school, that no one ever teaches us that our eggs or sperm may be abnormal, and being abnormal is more normal than not.
Yes, 100%. So yes, you're right. Humans are at the lowest end of the reproductive spectrum when it comes to our ability to reproduce. And that's why humans, unlike animals, do not carry litters, or they don't just get pregnant on one mating, etc. So yes, nature has controlled our reproduction in a very, very big way. But what we have noticed, Andrea, is that as time has gone and as we age, whether these are factors which are more biological or whether they are factors which are environmental, all these things are having an impact on our reproduction. So they always used to, one of the classic things you may have heard is that, your grandmother was more fertile than you are, or your grandfather had more sperm than you have. And it's true, because the environmental impact is more severe. And of course, the age at which couples now attempt their first pregnancy is much higher than what it used to be 35, 40 years ago. So all these factors are leading to a poorer reproduction outcome, and miscarriage being one of those poorer outcomes.
And you were talking about different treatments or things that maybe can give us an insight into what might be wrong, so that we can maybe prevent it from happening again. Where would you like to start? The embryo, or where would you like to start?
So I'll briefly touch on all of them. So yes, as I said, one of the most common questions we get asked in the fertility clinic by couples is for those couples who have faced a miscarriage. And we understand that this is very traumatic, losing a precious pregnancy, not just a pregnancy, a precious pregnancy, because these are patients who've been trying to conceive and it hasn't worked. So it's a very precious pregnancy. And when it ends up in a miscarriage, it is very, very traumatic and emotionally quite challenging. So the treatment options are very, very relevant. And it's very important that when you start investigating a couple for miscarriages, you run a fully comprehensive profile on screening them adequately, because you cannot afford to miss out one of the minute factors that is actually affecting the miscarriage, because otherwise we may be in the same position again. So in terms of the investigations could be a full miscarriage profile on the female, which includes checking for anticardiolipid antibodies, lupus, testing for thyroid profile as well, doing a full 3D scan, potentially a hysteroscopy as well in women who have either a polyp or a fibroid. There are some tests that we do in the IVF clinic called a 3D saline sonogram, which means we push some saline or fluid in the uterus to see whether there is any kind of obstructions in the uterus, such as a fibroid or a polyp. And if they are, these should be removed before attempting another IVF. So the hormonal investigations are by simple blood tests. The anatomical causes for infertility are essentially through imaging to see if there is any kind of obstruction there. And of course, cervical incompetence can also be one of the reasons why women miscarry, or some women have a very late miscarriage because the cervix just dilates and pushes the pregnancy out. So again, if it's a cervical problem, the women may need to have a cerclage or a stitch around the cervix. And then moving on to one of the major areas where assisted reproduction has taken big leaps and bounds to conquer miscarriages is the use of genetic testing of embryos. And the technique is called pre-implantation genetic testing, whereby we as embryologists take a small biopsy of the embryo or a small sample of cells from the embryo, and we test it to we send it to expert genetic labs who will test those sample of cells to see if that embryo is chromosomally normal or whether it's abnormal. And couples can prevent the heartache of a miscarriage if they screen their embryos for these genetic abnormalities, which will enable us as embryologists not to transfer those faulty embryos back or genetically abnormal embryos back. Our concentration would purely then be on what we call the euploid or the golden embryos, embryos that are genetically healthy. This gives the couple a much higher chance of getting pregnant, and not just getting pregnant, but to have a live birth with a very, very low miscarriage rate.
That's a very good point you've made, because the genetic testing prevents an eventual miscarriage by not transferring that embryo, which can also help people not have to cope with the emotional loss of the miscarriage. Because as soon as a woman is pregnant, it doesn't matter if it's a few weeks or if it's already 20, 30 weeks, it's her baby. And
Yes.
she starts imagining all the things that how that child is going to be. And so a loss, regardless of how many weeks, is the loss of a baby. So if we can prevent that awful, horrible experience, I think that can be very, very helpful to our patients.
Absolutely. And I see more and more patients going for genetic testing nowadays, even couples who whereby it's their first IVF cycle. It just makes logical sense, Andrea, that whilst we have the technology, why not use it to weed out the embryos that are chromosomally abnormal? Because we know that even in the youngest of patients, typically 30% of their embryos could be chromosomally abnormal. And of course, this figure just keeps on rising with age. So in women over 40, 80% of their embryos may be genetically abnormal. So yes, we know, we all say that the younger the patient, the better the outcome. But even in your youngest patients, you cannot prevent a miscarriage sometimes because they do have genetically abnormal embryos. And whilst we have the technology, it makes sense to use it.
And I think it can also help in the sense of the self-blame and shame that patients feel when they miscarriage, because so many times women feel, maybe I've done something wrong when they are having a miscarriage. So if we can help them and say, look, this embryo is genetically abnormal, and that would have been the reason why maybe you haven't gotten pregnant up until this point, because the embryos we're getting are genetically abnormal. It's not your fault. There's
Agreed.
nothing you should have done in terms of eating, lifestyle, or whatever to change that.
100%. So one of the, I always say that IVF is not just a treatment. IVF is also a diagnostic tool. So when you do get couples who have had repeated miscarriages, and of course, when you test their embryos, you can see why they have a history of repeated miscarriages, because finding that normal embryo is very, very challenging. Or sometimes couples just don't have a single normal embryo, despite having gone through multiple cycles of IVF and genetic screening. Now, with these couples, as you know the heartache of losing a pregnancy every time. And as you know, Andrea, some of these women have gone through multiple miscarriages, not 1, 2, 4, 5. So in these couples, I feel that when they have this information that they are not making any genetically normal embryo, it can also help in bringing a closure on one dimension and opening another door, which potentially they may consider, considering their history. So, for example, when couples, if they've had 3 or 4 IVF cycles and have failed to make a single normal embryo, genetically normal embryo, they may then choose to move further on with egg donation, for example. So I feel it is also very diagnostic when, and I'm truly a proponent of pre-implantation genetic testing, because I feel, why would I want to transfer that embryo if there's something wrong with it? I would rather know that there's everything right with it, and then I'm embarking on that pregnancy with a lot more confidence.
Absolutely. And Alpesh, I'm thinking, I'm mindful you have something next after this Insta Live, don't you?
I
You
do.
have an amazing event with IVF Answers. What are you going to be talking there today?
So today I'm going to be talking about the role of a clinical embryologist in outcomes of fertility treatment. So we all know that the embryology lab is a very, very critical part of the whole process. So today I'm going to be talking about what your embryologist does in the lab to make sure that they give you the best outcomes of pregnancy.
Brilliant. And if patients want to watch that webinar, it will be off Instagram. I would say they need to go to My IVF Answers Instagram and register there. It's going to be, is it at 8?
Yes, it's at 8 o'clock, and I believe you can either register on the website, myivfanswers.com, or through their Instagram handle as well. But yes, today we're going to be focusing on the science rather than the clinical aspects of IVF. And it's very rare that you get to hear what are the scientific developments in IVF. Generally, people just talk about the clinical developments in IVF. So today I'm just going to be focusing a lot more on exactly what have been the developments in embryology, because in all essence, the developments have been more in embryology rather than clinical aspects of reproductive medicine.
That is absolutely true. And it's usually, the lab is very hidden, so patients never get to see that. So it's good that you're raising some awareness of the lab where the science of making babies happen.
Absolutely. And, one of the things I often note, Andrea, is that, like you touched upon earlier, that fertility education is a huge problem in today's generation. The number of women I see, and when we talk about egg freezing or something like that, they never realize the decline in their fertility with age. And you often hear, only if someone had told me this earlier, I could have done something about it. So I really feel that there's a big gap in fertility education. And hence, my attempt to kind of be talking about these areas of developments so that couples and individuals are empowered with the right information and can make subjective and right choices for themselves.
And Alpesh, for patients who are ready to get in touch with you and maybe they've been having recurrent miscarriages and they want to maybe do some of those investigations that you were talking about, or just have a conversation about what they can do next. What is the first step for them to speak with you? Is it your open evening, or how can they reach you?
Sure. So yes, they can certainly, all the open evenings are virtual at the moment. So every Wednesday evening at 6:30, I do a open evening, which is virtual. And to register for the open evening, they can just go onto our website, which is ivflondon.co.uk, and register themselves through Eventbrite. So that is one option. Or they can call the clinic directly and book a 30-minute mini consultation with me, which is free of charge, so they don't have to pay, but that's a one-to-one. And again, it's all via Zoom at the moment. So those would be the first steps before you even see a clinician for an initial consultation. So the opportunities of having a no obligation chat is quite available out there if anyone wants to just reach out and talk about their journey. One thing I wanted to add as well, Andrea, which I forgot earlier on, is that there is more and more focus on the male now and the factors of the sperm that can result in a high miscarriage as well. So when I talked about investigations, I forgot to say that the male has to be investigated too, and the test that could potentially be done on the men is DNA fragmentation, which is how good is the DNA or the genetic material in the sperm head. So again, that is a very, very vital test, and more awareness and education is coming out around the importance of good, healthy sperm in preventing miscarriages. So we know for a fact that when the DNA fragmentation level is high in these men, then they have a higher risk of miscarriage. So attempts need to be made to correct that faulty DNA by having more of what you call lifestyle changes and maybe a better diet, a better improvement in their lifestyle.
That's a very good point, because some patients might have had a normal sperm sample and now they're having recurrent miscarriages, and because they never had the DNA fragmentation test, they don't know that the sperm looked normal, but maybe the DNA is not normal.
Exactly. So for a lot of these men, they feel they have a normal sperm count, but actually when you do assess the DNA, that is saying something totally the opposite. So we all know that the routine or conventional semen analysis or sperm analysis gives us very little information when it comes to the true potential of complex events such as miscarriages.
So I would say, Alpesh, if we could give like a takeaway for our listeners today before you go join My IVF Answers, what takeaway would you give for those listeners who are going through the challenges of recurrent miscarriage?
Okay, so one of the take-home messages is that, of course, we understand how difficult it can be to cope with a miscarriage, but there's no point in suffering in silence. Do get help. Even if you've suffered a miscarriage through natural conception, there are treatments that your clinic can offer to ensure that when you do get pregnant naturally again, we can help minimize that risk of pregnancy. So reach out to the clinic. The take home message is you're not in this alone. There are many women like yourselves or couples like yourselves that have faced various degrees of miscarriages when it comes to first trimester, second trimester. You need to get all the emotional and psychological help if you are undergoing a miscarriage, because we understand it's not easy to deal with. And of course, as I said, help in the right direction, investigations in the right direction is the first thing to do. Do not plan a pregnancy after pregnancy when this has happened to you again and again. There comes a time when you really have to start investigating and be responsible enough to prevent further impact on yourself. And the way you take that responsibility is by seeking medical help.
That's a very good point, Alpesh. Thank you for joining us today. I will let you go join Dorothy on or Caroline on
Yeah.
My IVF Answers. And everyone who's listening, join Alpesh with My IVF Answers on the webinar at 8 o'clock. And get in touch with IVF London through their Instagram or through their website as well. Thank you so much for joining us, Alpesh.
Thank you, Andrea. Always a pleasure. Look after yourself. Take care. Bye-bye.
Bye.